Welcome to the Healthy Habits for Active Aging podcast with your hosts, physical therapists Dr. Michael Gorman and Dr. Lauren Bennett. This podcast will discuss a variety of health-related topics focused on educating the aging adult, allowing for an active lifestyle no matter the age. Don't forget to rate, subscribe, and share. Enjoy the show.
Hello, and welcome to another edition of the Healthy Habits for Active Aging podcast. I promise you, community, this is a very special night. We have a very special guest I'm going to talk about in just a minute. But the topic for tonight is exercising after you've had a total joint replacement, whether that's knee, hip. Oh, shoot. We could even talk about ankle. We could talk about shoulder as well. But I bet we're going to primarily talk about the knee and hip. But, you know, as I was starting to study for this podcast, I did go online, and the American College of Rheumatology says that this year alone, there'll be 790,000 total knee replacements in the United States and over 450,000 hip replacement. So that is a ton. And a question that I know I'm asked, and all the time, I know that our guest, which I'll introduce her in just a second, has been asked a lot, is, what kind of exercise can I do after my total knee replacement, after my total hip? What can I do? After the initial couple months of the therapy is done and the healing is starting to occur and the pain's done, what can I have to do with that? So as I promised you, tonight is super special. This guest, this is a real treat, y'all. I promise you. I don't know why I just said y'all, because I'm not from the South, but this is a real treat because when I started to listen to podcasts a couple of years ago, when I started my mobile practice in 2020, I was in the car a lot. So I started becoming a huge podcast fan. And there was one physical therapist that really struck me as like, oh, this girl, she's got some great guests and these are great podcasts. And, well, I have that person as my guest tonight. So our guest, and please welcome her. Her name is Dr. Karen Litzy. Hello, Karen.
Hi, thank you so much for having me and for such a kind intro.
Well, Karen is not only a very special friend of mine, but I think you are on podcast episode like 650. Is that right?
Somewhere around that. Yeah.
I don't want you to think I'm a stalker or anything like that, but I just looked the other day and that's about where you are. So you've been podcasting how many years?
Oh, like 10 years on and off.
Were you the first podcast ever?
Well, maybe in the PT world, but close to it. Yeah.
I'm so honored, and hopefully tonight we can share some great things with our community. Like I know you've shared so many great things over the last 10 years with your community. This is a topic that is, I don't think, talked enough about. Like I know when a patient goes in to see the orthopedic surgeon, I'm going to bet that this topic doesn't come up a whole lot. Like, well, what can I do after all is said and done? Because they're so focused on their pain and just getting any function back. They're happy with that. But then that time comes where they want to get back into full life. So that's what we're going to do. But Karen, if you could you tell Healthy Habits for Active Aging podcast? Oh, by the way, we're like on number 44. So we have 9 years to go before we catch up with you. And that's if we do every week, which we're not. Oh man, forget it. We're not even close. But anyway, tell us a little bit about yourself and your PT background and your own business.
Yeah, so I am a physical therapist and I am based in New York City. I have a private mobile practice where I go to people's homes or offices, gyms, sometimes outside if the weather is if the weather's nice here in New York. And I've had that practice for about 10 years now. And before that, I worked in some small private practice offices here in New York and started my career in a hospital system in Scranton, Pennsylvania. And not only do I see patients, strictly for physical therapy, but a lot of the patients that I see are people who've had total hip replacements and total knee replacements. They've completed their form of physical therapy. They've been discharged, right? So they can climb up and down their stairs if they have them here in New York. They can walk down the block, they can get around, they can do all their ADLs, no problem, which is usually about the time people are discharged. A lot of the patients that I see, a lot of the people that I see are like, well, yeah, I was discharged, but I have plans to go to Greece this summer, or I have to pick up my grandkids all the time, or I want to get back to playing softball or skiing or whatever it may be. So although, like you said, the first couple months you're really worried, you're really concentrating on getting range of motion and edema or swelling control and the basic strength so you can do your everyday things. But people are living longer and living healthier longer, being active longer. So they're like, well, wait a second. There's still a whole bunch of other stuff I have to do. And I don't think I'm strong enough for that yet. So that's kind of where I come in.
Nice, nice. Well, yeah, I think it's kind of a myth, and I don't know if orthopedic surgeons are still saying this, but that total knees and total hips last about 10 years. Now, I think that that's perhaps old school, and I've been around this for a long time, probably much longer than you've been, but that's what it used to be. But I mean, so these people not only living, everyone for the most part is living longer, but they're living with their total joints for a longer period of time. So that's why
Right.
I think this topic tonight is so important. So all right, so let's start kind of diving in here. So let's say you've had a total knee replacement or total hip. What can you give us some general precautions to anyone that wants to get back to, again, we're talking now you've gone through your 3 months of physical therapy. What kind of precautions should we follow?
Well, I think always first be in contact with the surgeon if you're the physical therapist, regardless of whether you're seeing them the first week after that knee replacement or hip replacement or 3 or 4 months after, just so that you get an idea of what was done in the surgical procedure. I know now here in New York, I don't know where it is in other parts of the country. I assume it's pretty similar, is total knee replacements are way, way different than they were even 10 years ago. Now there's more robot assisted total knee replacements. People are going in the morning and they're coming home in the afternoon. There's rarely a hospital stay anymore. Same thing with total hip replacements. They're going in, they're coming out the same day. So I think it's important to talk to the doctor to see, well, what kind of procedure was done, what was used in the procedure, and then if they have any precautions, which usually at 3, 4, 5 months out, there's not many precautions.
Mhm.
But you do want to talk to the surgeon and understand what procedure was done, and then you can kind of take it from there. Most of the people that I see after they've had a total hip or total knee replacement, the doctors are like, it's been a couple months, no restrictions, have at it. In the beginning, for total hip replacements, it depends on, did you have a posterior and anterior lateral? Most of the patients I'm seeing now are having lateral or anterior hip replacements. But in the very beginning, if it was a posterior hip replacement, you can't, all those precautions are in. Don't bend the knee or the hip past 90 degrees, no crossing the legs, no internal rotation. I have not seen a posterior hip replacement in quite some time.
Very cool.
So most of the surgeons here are doing lateral and anterior, and they're like, have fun, do whatever the goal is, like, let's get at it.
Yeah, yeah, it's amazing. We have few surgeons in St. Louis are doing super path. Have you heard of that? Yeah, and I'm sure where you're at, tons more doing it, but the outcomes are to me pretty amazing, and what these people can do 2, 3, 4, 5 days post-op is amazing. But
Yeah, it's wild. I mean, seeing knee replacements where, because of that kind of robotic assistance, there's less soft tissue damage. The patients no longer need to be, for the most part, on heavy blood thinners like Coumadin or Xarelto. They're just on aspirin, which makes a huge difference for recovery. Swelling is less. Sometimes bruising is less, depends on the person, of course.
right,
But it's insane. And total hip replacements, like a miracle.
it is.
Like it's pretty amazing,
Yeah,
and given when I started, you know, 20 years ago, people would have a total hip replacement. And I don't know if you remember this, they'd be like toe touch weight bearing.
yeah,
Right? Like they had to go to inpatient rehab. You're in the hospital for a week, inpatient rehab for 2 to 3 weeks. It was bananas. Now it's like you have it done. They're like, see ya, bye. See you
I
in 2
think
weeks.
I think some of that is because of surgical advancements, and some of that is because of insurance.
Oh, yeah. Yeah.
Forcing people out sooner. But yeah, sometimes I'm amazed that people come home as quick as they do. But anyway, yeah, and I think that because not to get too off track, but because I think that total hips and total knees, what I say earlier, like almost 800,000 total knee replacements are done every year. People think, oh, it's just a common surgery, it's not really a big deal. But I make sure to emphasize to every patient or every one of my family. I have a cousin that just had total knee, and I talked to her 2 or 3 days before, and she really wasn't aware of the extent of what this surgery is, and the commitment that it takes post operatively to even get that what we want back from a range of motion or strength standpoint, and the amount of pain that one has. And so please make sure that you all understand that this is a big deal. I always tell people, if you're going to have especially total knee, have it in your downtime, if you will. If you're a big time golfer, don't have this done in the summer, because it's going to put you out for a while. So
Right. Yeah, I'm glad that you mentioned that because it is a big deal. Like if you think about it, total hips and total knee, it's a controlled break, right? And so I always tell people, like, you have to respect the surgery. Like you had controlled broken bones with hardware inserted into them. So it takes time. And yes, there's pain. And yes, there's discomfort, there's swelling, but like all that's normal in the beginning, right? But it's still a lot of work. And if you have to go into these surgeries really being committed to put in the hard work that it takes to get back. Like I tell most people, it's a year.
Absolutely.
And no one wants to hear it, but it's a
Right.
year,
Totally agree.
right?
Yeah.
It's not like, and then they'll say, oh, the doctor said I'll be fine in 3 months. I'm like, yeah, you'll be fine, but you'll feel more like yourself in a year.
Yeah. No, yeah, no, you're totally right. And when I was a student, this was in the days before the World Wide Web and before the YouTube sensation. I got to observe surgery, because that's oftentimes what you do as a student.
Yeah.
And I got to observe a total knee replacement being done. And I'm like, oh my God, these orthopedic surgeons are just like glorified carpenters. It was
Yeah.
amazing what I saw. But
Hammers and mallets.
but once I saw that, I'm like, I get it. Now I understand why the patients that are coming in to see me are in so much pain. So, okay. So what do you think is a general time frame for a patient? I know this is going to vary, but to get back to their exercise that they want, that they were doing before their pain shut them down? How many months? Let's go with the total knee and total hip. Let's get your opinions on both of those.
Yeah. And I think, of course, it's the PT answer, right? It depends. But one thing that it really depends upon is how debilitated were they going into surgery? Meaning, how long were they incapacitated before they go in for surgery? Because, some people will put up with the pain of osteoarthritis for a very long time and their lives will shrink. They'll say, oh, well, I don't have to walk that extra block or blocks, or oh, I'll just drive or take it. I'm in New York City, take a taxi. I don't need to go for that walk in the park. So their lives will shrink considerably and they won't be as mobile. So, then you don't have the same kind of muscle strength and power that you would otherwise, versus someone who, like I have a patient who had a total hip replacement a few months ago, but she had just a really rapid, sharp decline. In like 4 weeks, it got really bad. She was like, I'm having the total hip replacement. So in her case, it's not like she was incapacitated for months or years, which can sometimes happen when you are seeing someone who had a total hip or total knee replacement. So for some of those people, it's getting back to maybe where they were months or years prior to the total hip replacement or total knee replacement. And that's where we as physical therapists have to do a really thorough job at our evaluation of really asking those questions of like, okay, so you had this hip replacement. How long do you feel you were incapacitated before this? You know, what sort of impact did it have on your life? And I always ask people, what were you doing before? Like I've had people who are like, I just want to walk a block to go to the restaurant at the corner. I don't really exercise. I don't really do much. I just don't want to have that pain.
Sure.
Okay.
Sure.
And that's fair.
Right. Absolutely.
Right. And then you have people who might have been big walkers, runners, bikers. And if we can get the capacity and endurance of those muscles back, then, they might be able to do it. But I try not to make any promises on that first or second visit. But I think it just depends on what the shape they were in before they went in for that surgical procedure. That being said, like I said earlier, I tell people like, give it a year. But a year, and then you'll be like, oh yeah, I did have that surgery. It's kind of like, oh yeah, I had my hip replaced a year ago. I can't believe it. I find that, I don't know what your experience is, but I find that total hip replacements can tend to, people who have total hip replacements tend to get back to their routine, whether it's their workout routine or life routine, maybe a little bit faster than people who have had total knee replacements. That's just been my experience. Of course, you have the one-off here and there.
Yeah.
Has that been your experience as
Yeah,
well?
yeah, I agree. No, I think that total hips definitely come back quicker. And I'm the same as you. I tell people, look, this is going to take, especially after a total knee replacement, I said, this is going to take a year before you're back to where you want to be, or where, before it's normal and you're not thinking about it. And they always give me this terrible look because no one's ever told them a year. What are you talking about? I said, well, you're not going to be in, your pain is going to get better and better every week, every month. But I'm saying it'll be a year before you're moving and you're not thinking, oh yeah, I did that. I'm not thinking about it. And so with that in mind, like, what if you have someone who's more athletic and they want to get back to either pickleball or cycling or maybe even running, which we'll talk about here soon. But would you say, like, I think from a total knee replacement, getting back into those things, I might say 4 to 6 months.
Yeah, I was going to say about 6 months. Yeah. I think that's fair.
Yeah.
And I think it's a realistic expectation, right? You don't want to set people up to fail by saying, oh yeah, you'll be doing this in 3 months. And then they're like, wait, what happened? Now, if someone's a big golfer, you can golf at 3 months. Sure.
For sure.
Why not? You may not be able to walk the course. You may get a little tired. But the mechanics of golfing and everything, I think you can definitely get back to that in about 3 months or so. Cycling, I think it depends. Certainly indoor, if you want to take like a spin class or something, like, have at it. You can certainly do that at around 3 months or 4 months. You just may have to adjust some things.
Absolutely.
And I think it's important to note that you can do the things you were doing before, just maybe not at the same intensity right away, but you can build things up, So I think getting people back to some sort of semblance of the things they were doing before, whether it's for less time, less intensity, less, I don't know, weight, let's say, right? Less overall load. And then you slowly have them build up the load. That's therapy too, right? That's training.
Absolutely. I tell every patient that I see, whether they're total joint or whatever, low back pain, whatever it is, when you start getting back to the things that you want to do, you've got to do maybe 20% of it that first time and just see how you tolerate it. And you have to progress. It's just taking baby steps so we don't overstress that joint or that low back or whatever it is. And I think that's super important. I also think it's really important for the patient, if it is a more athletic patient, to make sure that you link up with the right physical therapist for you. Because I always say that physical therapist A is not equal to B is not equal to C. And sometimes you want someone not that's aggressive, but maybe more proactive. If you are that patient that wants to get back to cycling, pickleball, running, golfing, all those things, because those are going to make more physical demand on your body.
We hope you've enjoyed this episode of the Healthy Habits for Active Aging podcast. If you have any questions for Dr. Gorman or Dr. Bennett, please send an email to info@imovephysicaltherapy.com. To learn more about healthy aging, visit our website at imovephysicaltherapy.com. Like what you hear? Be sure to rate and subscribe. See you next week.